Well, here to talk more about this, NBC News medical contributor, Dr. Natalie Azar. Doc, good to see you.
Good to see you guys.
So it would seem that you wouldn't even need to suffer from chronic pain to benefit from this. Almost anybody could, it would seem.
Yeah. I mean, it can treat localized pain, and it can treat more generalized, what we call myofascial pain. As was said in the clip, this is fascia. This is your connective tissue that basically attaches and stabilizes your muscles and all of your internal organs. And when the fascia is loose and hydrated, you're mobile, you're flexible, you're stable. But sometimes because of injury or inflammation or trauma, or sometimes from just sitting in one position for too long, the fascia loses its hydration and it gets tight, and it compresses the nerves and the vessels that are running through muscles and can cause pain. So the idea behind it is that you need to re-lubricate, so to speak, the fascia. And partly you're doing it, you can hydrate, right? So you want to drink water. But think of it if you had like a kink in a hose. The water that you drink isn't going to get to your fascia unless you can break it up and open up that hose. So this is an example of a handheld fascia blaster that Ashley Black is talking about. The way you apply it, she does this in a very easy to understand video. You need to use oil, so you're not using it on bare skin. So we already oiled up Jamie's skin. And you can do this to yourself for 3 to 5 minutes pretty vigorously.
Wow,
you know, I mean, I can't quantify the pressure, but you got to get in there hard enough.
And I got to say, my arms are really sore from yesterday at work, and this isn't. I can bear this. Like, this isn't too bad, and it's
So and Ashley basically says that you can look how your skin's getting a little mottled. That you can expect and anticipate some bruising. It's not abnormal to do that, and then she has a whole regimen, you know, for before and after.
Is there anybody who shouldn't do this?
Not really.
Really?
No, you want to be getting in there and loosening things up. I don't know. I have to tell you, like, this is another example of one of these segments that we do that I feel like could apply to so many, certainly of my patients, and just people at home, everybody with chronic musculoskeletal tension and pain and things like that. I think
I've got to get one. I got to get one of those.
Do it yourself, and there are also people, certainly there are therapists who are trained in this kind of therapy. You can ask your provider about them.
Very cool. Natalie, thank you so much.